Just a little postcard. It came last week or a week before.
Cool. Yeah, I'm sure it's somewhere then.
Because they had a change of venue. Why am I looking sideways? Oh, that's from before?
No, that's a delay.
Am I live?
You're live.
What? Folks, really?
Yeah. Well, you know how I do things.
All right. Oh, now you can hear me too.
Let's do it on this side.
People are loading up. All right, Dr. Paul here. We are finally getting back to you guys with a
Don't worry about comments.
live stream, and it is an honor and a privilege to be with everybody that's going to join in. Most of you know I'm back in the office. Yay! I want to also tell you that in the 7 months that I was not in the office, one of the most important things I've been doing is I started a show. So the show is available at doctors and the whole word AND, doctorsandscience.com. I would love for everybody on this YouTube channel, on the Paul Thomas MD YouTube channel, to go and become a member. Here's why. We need to stay in touch, and I may not have a mechanism to do that unless you are a member of that organization, so that way I have your contact information. So just give that some thought. If you want to be forever in touch so I can get a hold of you no matter what happens, doctorsandscience.com. Become a member. There is a slight monthly fee. I think it's less than $5. It's a cup of coffee, right? And that supports all the work I'm doing. Most of you know, since I had my license taken last December 3rd and have just been working now in the office for a couple weeks, that no income for this guy, and I'm not complaining. I'm just stating the facts. So to support everything that I do, that would be awesome. But I'm here for you. This is the show where we just talk about general pediatrics, anything that's on your mind. And so I've got my producers right here with me to read me questions that you have so that I can just answer whatever's on your mind. This is our time for about 40 minutes, 30-40 minutes.
Yep. So we will randomly select them. Well, I'll play with them as much as you want, but if they want to get your attention and guarantee your question is answered, consider using the super chat function.
Okay, my producer says we may get so many questions that to get to the top of the list, there's something called super chat. I remember we used that before. He'll keep on top of that, and so feel free to use that. I guess that also helps support the channel, and he'll be looking for questions and getting to them as fast as he can.
All right, let's see.
So if you have family members while he's looking for questions, he's ready.
Sandra Rodriguez says, my toddler had thrush inside the mouth lightly. How can you treat it at home with remedies?
So thrush inside the mouth of a toddler. Thank you for the question, Sandra. In the old days, they used to use gentian violet. I'm actually not a fan of gentian violet because it's a carcinogen, but you may have remembered seeing kids with very purple mouths. It works. You would just paint the inside of the cheeks and tongue with gentian violet, but I don't like that because it is a carcinogen. So I would go with an antifungal agent, and you do need a prescription for that. So you would just go to your pediatrician or provider, and they can write for that. It's usually diflucan is what's prescribed.
Go ahead and toss out a disclaimer.
Oh yes, disclaimer here, this is just an informational show. I try to be as specific as possible so that I'm helpful, but it is not intended to be medical advice. You should absolutely run everything by your trusted healthcare provider.
Lindsay King says, my 5-month-old won't take a bottle, only wants breasts. Any suggestions? I've tried some other bottles.
A 5-month-old who only takes the breast will not take a bottle. I've seen this so many times. So breast is best, and if you have a good milk supply and you're able to keep breastfeeding, obviously go for it, but a lot of times you need a break. And so how the heck do you get a baby to just take a bottle from somebody so you can have a break? And if you've got a really stubborn kid who knows what they want, which is you, mama, I think the only way, honestly, is you have to disappear for the better part of a day and have a really good, nurturing grandma type. I mean, it could be dad if they're really good with babies. Somebody who's really good with babies and can handle a fussy baby, because babies will refuse the bottle for almost a day. I'm talking not 24 hours, but like 12. But they will eventually get so hungry that as long as you've got an adult who knows how to handle a baby, they'll take it. They're not going to starve themselves to death. So sometimes you just have to force the issue. That would be my best suggestion. The other thing is when they're really sleepy, some babies will just sort of, you can just kind of, while they're dozing off, get a bottle in there and they don't even realize that it's a bottle. They think it's the nipple.
$5 super chat from Mandy Rose. Is it safe or a good idea for a 3-year-old to get the V word?
Okay, so on this channel we're trying to avoid V words because channels are getting taken down and demonetized and things like that. So a 3-year-old getting a V, right? A specific V, like that deals with things that are going around right now. So I think we're talking about something that's experimentally approved that has no long-term data. So I don't think there's a way to talk about the safety. This is something I address in great detail on the show. doctorsandscience.com is where you access it. It's every other Tuesday. There'll be a link in the description. And next show, which is in 11 days on Tuesday, we deal with that very specifically with data from the CDC. So I would encourage you to plug into that. Every week we're basically covering that issue. It is obviously on the top of everyone's mind. Thank you for the question.
What's the say her name? Mandy Rose.
Mandy Rose, thank you for that question.
All right. We've got...
And thank you for the super chat, by the way. I missed the fact that was... folks, super chat is just a great way to support what we're doing, and I do appreciate it very much.
And your question will get jumped to the front.
And my producer says that jumps your question to the top. He's scrolling through a lot of them, I guess.
Amin says, how did you maintain a positive mindset all through your license having been taken away?
Thanks for the question, Amin. How did I maintain a positive mindset? I'm blessed being a very positive person to begin with, but it was a big blow. I will not deny that. Actually, I think what helped me the most is I had a coach. I had a wellness coach who really kind of just walked me through what I was going through. And I really had to turn into myself and turn into more of a spiritual openness to that. I'll just call it love, right? That greater love that exists for all of us. I learned how to do breathing. That was super helpful. Close your eyes. Breathe in love. Breathe in God if you're a spiritual person. Breathe in whatever it is that grounds you. And then exhale through the mouth. Fear or stress or whatever it is you need to get rid of. That is a powerful technique. I recommend it if you're feeling stress. It works. And you can do it. Don't hyperventilate, right? Go slow. Usually, there's lots of, I've read books on breathing actually, but the easiest one is the same amount of time that you're breathing in, you breathe out, and you can breathe in and out the nose or breathe in the nose and out the mouth. I think that's what helped me the most, and I've been reading positive things. I don't watch anything on TV anymore. I found that helpful. Staying with my exercise, eating very healthy, whole foods. I actually have gone mostly vegetarian, whole food type eating, almost never eat meat or chicken. I do some seafood. So dialing in the diet, focusing on rest, exercise, self-care stuff. It's really important. And I think it's more important now for all of us than any time before in our lives.
Very Puny says, hey, Dr. Paul, I have strep right now. Any tips?
So Vary's got strep, wanting tips. I know there are naturopaths who treat strep without antibiotics, but even most naturopaths, I think, are aware that strep is just one of those things. You take antibiotics, it knocks it out within 24 hours, and that's probably the way to go. So I would suggest you just see a doctor for that.
Mindy Tiemo says, "Will you ever visit Zimbabwe again?"
Mindy's asking if I'll go to Zimbabwe again. I was last there in 2009. I have kids, my adopted kids are from Zimbabwe. So I would certainly hope that I can visit again. It's really a juggle economically at this point and logistics. But yes, I do hope to go back again.
$10 super chat from Joanna Alanis. She did not include a question, so I'm assuming she didn't realize how. Thank her and let her know I will be hunting for her question.
Joanna Alanis, thank you for the super chat. And we didn't get it with a question, so maybe try to shoot a question our way again,
and we'll find it.
And we're going to look for it.
Here it goes. Joanna says, "Hi, Dr. Paul. I've been delaying my MMR. I told my pediatrician I would be out of the country for a few months. How will I catch up with the V?" So again,
so an MMR that was delayed out of the country, how do you catch up? So the MMR can be given at any time after 12 months of age. So if that is one that you want, you can get it at any time. I don't know if that answers the question. If you've had one, another way to go is to have your immunity tested. So blood can be checked for measles, mumps, and rubella titers, and if you have immune titers, you don't need a booster.
Awesome. We have another super chat from Matthew Burke.
Thank you, Matthew Burke, for the super chat.
Good afternoon, Dr. Paul. I'm an aspiring pediatrician. I'm just wondering your thoughts on working in a hospital versus working in a private practice.
So an aspiring pediatrician, a question about working in the hospital versus private practice. Well, pediatrics is an amazing career. I love it. I love it, however, because I am independent. I love it because being independent, I've been able to really focus on wellness as opposed to sick care. And in our training, if you're in training already in medical school or in your residency training, you will notice that we are trained to diagnose and treat. And we're really just putting people into algorithms of which pharmaceuticals we use for what. Real health and wellness is actually what I've been about from that earlier question of how did I handle the stress, right? It's really about lifestyle choices. And if you can focus on that, you can have people who rarely get sick, including kids. The other huge issue you're going to face in pediatrics is what do you want to do about the V word? Because, I mean, the protocols are there and you have to follow them, especially if you're hospital-based.
Another super chat from Explain Cause Don't Get It.
Explain Cause Don't Get It. Thank you for the super chat.
It says, we just purchased a product called Advanced TRS. It's a Zeolite spray for toxin and contaminant removal. Is that useful for child with level 1 autism?
Advanced TRS spray. It's a zeolite, which is it's a molecule that can bind toxins, and the question is, would that be useful for a level 1 autism child? I have heard numerous reports that it has helped. It makes sense that it could help. It's not a product that I have been, offering or providing to patients, but I support patients who want to try it.
Another super chat from Ephraim C. Dr. Paul, my fiance and I are having a baby boy in November. What is the best way and importance of getting screened for Krabbe or leukodystrophies?
Excellent question. Ephraim, thank you for the super chat asking about screening for Krabbe's and leukodystrophies. So if you are in a state that does not have those on their newborn screen, and I'm guessing you are or you wouldn't be asking the question, there is it's about $100 you can send off for the testing kit, and I'm trying to remember the name of the website. We will put it in the link at the end of this show. It's something one. It's just, I'm drawing a blank, sorry.
Hunter's Hope.
Oh, huntershope.org. Thank you. huntershope.org. We have videos about Krabbe's. You can look those up. We promote, Hunter's Hope there. It's worth the $100. I mean, of things that you're going to do, it is absolutely worth doing that. And the reason is, we used to think it wasn't treatable, but it is now treatable. It's not easy to treat, but it can be treated. And I have cases in my practice of kids who've been treated and are doing great.
Marcy Ann says, and you can answer this with acronyms, How do you know if you should have your kid tested for the C word when they have cold or flu symptoms?
So Marcy's asking how you can know whether to test your kid for the C uh, diagnosis when they have cold and flu symptoms. It's a great question. So we've started to have more and more kids coming into my practice wanting testing. It's basically they were exposed at school or daycare, or somebody in the family was exposed, or somebody got the condition, the virus, and they want to know if they should be tested. I'm testing in my office. Here's why. If I don't, people are going to go somewhere else to get the testing. The testing that is available to me to do in the office is much like the testing that's out in the community. It's of those large PCR cycle numbers in the 35 to 40 range. So we will get false positives when you use that sort of testing, which creates anxiety, and that's the downside of testing. But the positive is, if you are positive, there is certainly a better chance that you do have it, and you would quarantine, and that's worth doing. And also you would then jump more aggressively on the protocols that reduce the ability of it attaching to ACE receptors, for example.
Maybe we just bring up the fear aspect of the soluble.
So I think, what was your question?
Well, the question had to do with whether it's just bringing up the cold symptoms, do you test it for the virus, and just address the whole no need to be hyper-afraid.
Gotcha.
There are steps you can take.
Yeah, my producer was reminding me that the fear is what makes people want to do things or not do things, right? And there really is no need for fear, especially with kids. The outcomes are so amazingly positive for kids who get this illness, and the natural immunity that develops is superior, in my opinion. I mean, that's what the data seems to be showing. So this whole issue of getting herd immunity, so how do we get our population to be immune such that this stops to be an issue, and really a couple seasons and that should happen. It's by getting the V, right, and getting the illness, and then developing your immunity, and now you're protected, and you're helping protect society by doing that. Kids would be the best to take that level of natural immunity to a much higher level.
All right, RJ with a super chat says, besides probiotics, what's good for chronic runny stool in a 2-year-old?
So RJ, thank you for the super chat. What's good for a runny stool in a 2-year-old?
And it did include, stool sample negative was also included.
Stool sample negative, and this was after antibiotics.
Besides probiotics, what's good for chronic runny stool in a 2-year-old?
Gotcha. Besides probiotics is definitely good. If it's chronic runny stool and it's not related to antibiotics, probably need to figure out why. And I've found a lot of times it's something in the diet that the child is sensitive to. So you can do food sensitivities. There's actually a way to do that from home. I've made this available at Turtle Healing Band Clinic Northwest.com. Just the initials, THBC North NW.com, and go on the testing and pick the food sensitivity test. It's a little skin prick. You do at home, send it in. When you identify food sensitivities and you remove those from the diet, it can sometimes make a big difference. So that's one thing to consider. I would get dairy out of the diet right away, see what happens. Consider getting gluten out of the diet, see what happens. Sometimes those two are the biggest offenders. And if you're still having problem, I would see a doctor to just make sure you're not missing some underlying inflammatory bowel thing, and there could be other issues going on.
$5 super chat from Matteo, Euro actually. Euro super chat.
Thank you, Matteo.
He's from Italy, and he says, in March, as a teacher, I was made to take the AstraZeneca V word, and in June, they made me take the Pfizer V word. What are your thoughts? And you can skirt this carefully.
Yeah. So as a teacher, you were made to take two different brands of the V, and wondering what my thoughts are. Yeah, they're saying you can do that. You can mix brands. Obviously, we have no long-term data, so it's really unknown what it's going to be like. I think there is potential benefit, so it's not all negative, and you've done it, so you hope for the best, right? But all I would say is this: if you develop symptoms that are bizarre, so anything that's like now it's new, you never had this before, I would say it's reasonable to assume it might be related, and then you dive in really, really strong to some of the protocols that are available. So the frontline doctors, we provide links in my show. We're covering this all the time at doctorsandscience.com,
First link in the description.
and there'll be a link in the description.
Okay. Sopra Hill gave us a $5 super chat.
Thank you, Sobra.
Forgot to include a question. Tell that person I'll be looking for it.
We'll be looking for your question. It didn't come with that super chat,
So just
Sobra.
chat it publicly.
Yeah. Go ahead and just put that publicly, and we'll try to get it.
All right, we're going to grab someone from the regular feed real quick. BDSDA says, any tips for acid reflux?
Any tips for acid reflux? I'm curious on what age. I'm going to just guess that it's a kid since I'm a pediatrician. So reflux, which is this phenomenon. We eat food, it goes down the esophagus into the stomach. When food or liquids, if you were breastfeeding or formula feeding a kid, for example, creates the production of acid. And sometimes that acid can go up the esophagus, and you can either throw up, you can irritate the esophagus and get fussy if you're talking about an infant. And, you know, adults, we burp and belch and all that good stuff. So what to do? Well, that's a really good question. There are pharmaceutical products that MDs will use, and they reduce the acid production in the stomach. And that can be helpful if you've got burning of the esophagus, because then what's refluxing up is not so acidic, it's not going to irritate as much. So things like omeprazole, cimetidine. I think the cimetidine was pulled off the market in this past year, and so people aren't going to that right away. But medications can help. Smaller, more frequent feeds, if you're talking about an infant, can help so that you're not having a really full stomach that's more likely to come up. Those would be a couple things I might suggest right off the get-go.
Sopra Hill's question just came through. She was our previous.
Sopra, thank you for the question.
My 21-month-old baby only has 3 words. Should I be concerned?
So a 21-month-old with 3 words is about where I was with 3 of my 4 kids. I have 4 kids that I raised from babyhood. I have others I got much later in life, so I don't know their story at that age. The normal range, you would say, yeah, my 3 kids and yours were a little slower than we would like, right? But it's not a panic time yet. I think you want to be sure that they're hearing normally, which, you know, whisper from behind on one side and see if they turn to, you know, to the side that you're whispering. That's a at-home screening. Get behind them and clap and make sure they're blinking. If you're unsure that they're hearing properly, get that tested, of course, because that would delay language, and that might be an easy fix, whether it's from chronic fluid in the ears or there's something else going on. If hearing's normal and development is otherwise normal in all areas, in other words, your baby is social, they're interactive, they're fun, they're playful, they laugh, they follow instructions, go get the ball, they go get the ball, kick the ball, they kick the ball, or you know, whatever you want, they're engaged. It's just their expressive language. If you understand they're hearing fine, they're not having any problems understanding, the brain's working fine, it's just the expressive language. Give it a little more time. You honestly don't have to worry unless they're regressing.
Brad Hargis, $5.
Thank you, Brad.
Oh, wow, $40. $5 from Brad saying, daughter got hives on and off for 3 days when running a 104-ish fever. Is it normal for hives to be present during a viral infection?
Hives with a 104 fever and a viral infection, yes.
On and off for 3 days.
Yeah, the fever was on and off. The number one cause of hives, which we think of as an allergic reaction, is to a virus. So it absolutely is normal. You also just want to run through the list of other things that can cause it, like were they on antibiotics? If so, you stop them. Was there a new food? You stop that until you figure it out. But it was probably the virus, yes.
$5 super chat from Be the Monster or Be Devoured.
B, the monster or devoured. Thank you for the super chat.
Is PCR testing flawed if its cycle threshold is too high? And what does cycle threshold mean?
So the more times they run this test through what they call cycles, the more likely they can pick up smaller and smaller amounts of DNA, right? The amino acid sequences can be tiny and they still pick them up. So you get to a certain number of cycles. The CDC has picked 28 as, 28 or less cycles, a positive is really a positive. And actually there's a couple studies published last year that showed that indeed around less than 15 to 20 cycles, you could actually culture the virus almost every time. By the time you get to 35 cycles, those studies could never culture the virus. So in other words, it's so little material you're looking at that when you get a positive, it doesn't represent an actual viable virus. And so those are what we call false positives. You think you have the virus, but you really just have some bits of sequences of amino acids that might be the virus, but might be a lot of other things. So yes, the number of cycles is important. I like the idea of 28 or less. I have a much better chance of those being meaningful. Sadly, most of the tests out in the community are 35 to 40, and especially if you're not sick, it's pretty meaningless.
In your opinion, this isn't medical advice?
In my opinion, this is not medical advice.
Brad Hargis, Super Chat, says, my daughter had a reaction, parentheses, loss of talkativeness in response to her name at 9-month V appointments. We haven't V'd since. How do we look into reintroducing at 27 months?
So Brad, thank you for your support. And the question about having a loss of development, language I think it was specifically, after 9 months visit where the usual protocols were done in a pediatric office. Now you're at a little over 2 years thinking about maybe you get back into that process of following traditional approaches. I think you still have to be cautious. Unfortunately, in my practice, too many times I've seen regressions occur. Your child's body gave you a clue that it was not responding well to that treatment modality, and there's no reason to think that it's going to respond fine now. So I think you still have to be cautious. But that is not a recommendation, and that is certainly not standard recommendations. The standard recommendations are you just follow the protocols. Don't worry about anything.
All right, I'm going to ask you this. Hopefully you don't give me talking to after $40 super chat.
Thank you for this super chat.
From Riyad Ahmed.
Riyad Ahmed, thank you.
Did you get V'd?
So, no, I did not. And I will not. I will retire. I will go through the necessary steps. So here in Oregon, you have to test weekly is the new recommendation that just came out. So that's what I'll do. And I will for sure not see any patients if I'm sick. I mean, that's just an abundance of caution and respect. Like I said, this is an illness that needs to be respected, but at the same time, I don't fear it. I know what to do to minimize my chances of having severe illness. I know what to do if I get severely ill. And you can too. Watch doctorsandscience.com. That's the website, doctorsandscience.com. And we're constantly reminding people what you can do.
Well answered, sir. We got this is a new feature on YouTube, guy, called Super Stickers.
So we got a new feature called Super Stickers. It's news to me.
So Sopra Yale, whose question you answered, left a $10
super sticker.
Right, where they get to put number one fan bouncing.
Number one fan from
Sopra Yale.
Sopra Yale. Thank you.
Awesome. And now we have another super sticker from Stacy Green.
Stacy, thank you for that super sticker.
Clapping with a bravo.
Oh, we get to see little fun things.
Yeah,
my producer gets to see all the fun things. I'm just looking at the screen. No, I don't mind. I'm happy to be here with you guys. Thank you for all the support. It really means a lot.
Okay. Let's see. How long have we been at this? What's the timer say there?
Oh, I've got another 10, 15.
Cool. Let's do 15 more minutes.
So 15 more minutes. I definitely have to go. I'm seeing patients at that point.
Yeah, 15 more. 10 minutes. 10 minutes.
Let's do 10.
Jafar Almweiser says, what do pediatric cardiologists do?
Jafar, what do pediatric cardiologists do? They do a lot of echocardiograms because general pediatricians like myself, if I hear a murmur that I'm worried about, this could be a heart defect, We send them to the cardiologist, and they will do their goop on the chest echo and look at the heart and make sure it's structurally okay. There are interventionists, so pediatric cardiologists, who are actually going to go to the cath lab where they're putting a catheter up into the heart to do some certain repairs, simple repairs of valves, things like that. They tend to be very closely affiliated with hospitals so that they can be there in those operating rooms basically to do procedures. But I've also known pediatric cardiologists who just work out of an office, and they're both mostly doing echocardiograms following the patients who have serious heart issues. So they would be, drug management of, heart support for kids who have a lot of problems with their heart, and yeah, it's an interesting, actually a pretty interesting subspecialty.
Alexandra says, respectfully, has your license been reinstated? Question mark.
Alexandra, yes, my license has been reinstated. They put the conditions that I'm not to talk to patients about vaccines or do well visits, which is at a time where those are done.
Jude says, do you have any tips for alcohol poisoning?
Jude, tips for alcohol poisoning. So, alcohol poisoning is that state that you can achieve by drinking way too much, way too fast, right? The liver can only detox about 1 drink an hour. And so if you overdo it, you can reach a blood alcohol level where you can die, right? Generally over 0.4, I think. But if you're not used to alcohol, you can actually die at lower levels. So the management for alcohol poisoning is really hospitalization and IV fluids. And then if you've done it really massive alcohol poisoning, they might have to support you in other ways as well. But definitely get to a hospital if you're in that situation.
So we're not going to answer the specific question, but what would be a general thing that you would say to people when they're considering these overall? And maybe this is just a point we want to bring up: informed consent, do your research, pros and cons, consult with a doctor who's willing to talk to you. Just give one of those disclaimers, because Melissa Clark keeps asking about her daughter following your V schedule from your book. They're considering reintroducing though at age 3. Now they're older, maybe they start doing these. What's an overarching thing you can say to Melissa just when it comes to making decisions about their child's personal health when it comes to those protocols?
So, Melissa, thank you for the question.
It's a lot of people
and others have asked this question about basically the issue of childhood vaccinations, the CDC schedule, other approaches. Like you all know, I wrote the book, The Vaccine Friendly Plan. The intent there was not that here's a different way or a better way necessarily, but the intent was to have people be informed about anything that goes in your body, right? We call it informed consent. I want you to, as a parent, be the representative for your child to think through absolutely anything that a doctor recommends you do to your child. I mean, they're healthy, presumably, right? Most kids are born healthy. How do we keep them that way? And the paradigm I was trained under was the CDC schedule. The AAP says this is what you do, and it's a one-size-fits-all protocol. I think we're at a time in medicine where most people understand there is no such thing as a perfect one-size-fits-all anything. So it's just a matter of, look at each decision. I'm being told for this newborn to do this and this and this. Does it make sense for my newborn? Are they at risk for those conditions? And I cover all that in my book. It's peer-reviewed literature. And so it's solid information that I highly recommend you dig down into. As far as, do you jump back into a mainstream approach if you've been doing less than a mainstream approach? The CDC would say yes, at any time. There are catch-up schedules that are very aggressive. If it was my kid, I'd be less aggressive if I was catching up. But some people have to catch up in order to be able to participate in society, right? They have no choice as parents. They can't homeschool. And so you're stuck with having to catch up, and just watch your kid very closely for side effects. Do whatever you can to detox. Glutathione, N-acetylcysteine, vitamin C, a little bit of selenium. There are a number of things one can do to try to allow yourself to navigate those risks with less damage.
Brad Hargis, who's done a few super chats, said another one saying, I wish you were in the Midwest. I have to drive quite a bit to see a non-standard immunization schedule, doc. Just thank you for answering our questions.
Thank you, Brad, for the ongoing support. Appreciate you, and good for you for seeking out the care that you know you're wanting. It sounds like you're an amazing parent.
Oh, another one wants to navigate carefully. $5 super chat from Blue Baby says, my son is 16 months and I've refused the MMR and chickenpox. At what age would you recommend the MMR? He's had bad 104 fever from other Bs. Maybe you just stick with the CDC and then refer to the last thing you said.
So the question about the MMR you've chosen not. Thank you for the super chat, by the way, Blue Baby. Yeah, my book talks about giving MMRs at 3 rather than at 1. There is some support of that based on whistleblower William Thompson's data that he came forth that actually showed that kids did better if it was delayed till age 3. So that is science-based. He was the main researcher from the CDC that looked into this issue. So I'm merely, sharing that piece of information. That was all exposed in the movie Vaxxed. This is such a tough topic. I am not to talk about it to patients, so this is purely informational, not intended to guide you one way or the other. The CDC is the recommended schedule, and so keep that in mind. But I think it's still wise to individualize again any medical treatment to your own risk factors.
Okay. I think we're at a good jumping off place. You want to just say
all right.
To everyone?
I want to thank all of you. I'm going to have to wrap it up and get back into the clinic. The goal is to do this every other week at roughly this time. So it will be every other week on a Thursday, probably at 12:45, 1 o'clock Pacific time for 30, 45 minutes, depending on how much time I have before I have to go in and jump into patient care. I appreciate you being on. I appreciate all of you who supported with super chats. And what were the new things?
Super stickers.
Super stickers. Believe it or not, YouTube is my only income so far this year. So this is really helpful. It's weird. A doctor who only lives on YouTube income. Wow. It's a whole new day. Anyway, I really appreciate you guys. And check out doctorsandscience.com. I'm Dr. Paul.